Hello, and welcome to Voices in Care, the official podcast of Apollo Hospitals. I'm Dr. Madhu Sasidhar, President and CEO of the Hospitals Division of Apollo Hospitals. At Apollo, we believe that healthcare is not just about technology or world-class infrastructure. It's about people. It's about listening, caring, and understanding. And that's what exactly this podcast is about. Through Voices in Care, we will bring you the stories behind the science. Stories of clinicians, patients, innovators, and thought leaders who are shaping the future of healthcare, not just here in India, but across the world. In each of these episodes, we will dive into these critical conversations. From breakthroughs in medicine and digital health to the deeply human moments that define care. We'll explore how compassion and innovation can go hand in hand, and how Apollo is making healthcare more personalized, accessible, and sustainable for everyone. For the first of our series, Voices in Care, it is my pleasure to welcome to this podcast Dr. Sathyaki Nambala. Dr. Sathyaki is a chief surgeon in the Department of Robotic and Minimally Invasive Cardiac Surgery at Apollo Hospitals, Banargata Road. Dr. Sathyaki is a world-renowned expert in robotic and minimally invasive cardiac surgery and was responsible for introducing these modalities to cardiac surgery in India. Before joining Apollo Hospitals, Dr. Sathyaki served as a senior clinical fellow in cardiac surgery at the Brigham and Women's Hospital affiliated with Harvard Medical School in Boston. He also received advanced training at the Peter Monk Cardiac Center at the Toronto General Hospital in Canada. In 2009, Dr. Sathyaki established the minimally invasive cardiac surgical program at Apollo Hospitals. At that time, this was the first comprehensive and dedicated minimally invasive and robotic cardiac surgical program in India. His pioneering technique for minimally invasive multi-vessel coronary bypass grafting has set a new global standard, and today the team has completed more than 5,000 procedures at a single center. In 2019, the team led by Dr. Sathyaki pioneered robotic cardiac surgery. Since then, this team has completed over 500 robotic cardiac surgeries at Banargata Road. Today, it is my pleasure to welcome Dr. Sathyaki. Dr. Sathyaki, thank you for taking the time from what is a very, very busy schedule, and thank you for joining us today. Sathyaki, we have had many discussions about the profession and what draws each one of us to this profession. Tell me, what drew you to cardiac surgery?
As I grew up and became a doctor, actually people joked when I wanted to be a cardiac surgeon, saying that there are only 5 surgeries in cardiac surgery. You're going to get bored doing those things. There's nothing in there. But cardiac surgery was like, being a commando. It was a challenge. It was not only a challenge in terms of the difficulty, it's also a challenge to yourself. In seeing whether you're going to break doing this. I think that challenge was worth it. So that's probably what led me to being a cardiac surgeon, because it was fascinating. It was hard work. It was tough on you. And then you actually saw good results. When you did it well, you saw patients walk home. Not so in neurosurgery. You could do great surgery. Patients could still, not really walk back home. Not in any other kind of surgery. But cardiac surgery was different. It had everything attached to it, from glamour to hard work to discipline to everything else. And at the end of the day, when you did it well, patients went home happy. That was the best part of cardiac surgery. And I think that's what drew me to cardiac surgery.
So on your journey to becoming a cardiac surgeon, at some point you decided to focus on minimally invasive cardiac surgery and especially robotics. Tell me, what was your thought process? What attracted you to robotics and minimally invasive cardiac surgery?
In my most distant vision, I did not perceive that one day I would be doing robotic surgery on a routine basis, practically every day. Does it add value? As on value, not in terms of what it does to patients, but in terms of what it does to my work? I would say 100%. And the reason I would choose robotic surgery any day is because of that added value. And what is this added value? The first thing is the vision. And any surgeon will agree that the most important component of surgery is vision. If you have great vision, you do great surgery. If you have poor vision, you don't do great surgery. Ultimately, the outcomes can still be the same. You may not see very well, but you might get away with doing some, surgery, particularly surgeries like mitral valve surgery. You can still do it reasonably well to give you equally good outcomes compared to robotic surgery. But the joy of doing this surgery, the joy of seeing the mitral valve at 10x magnification and being able to see every nook and corner inside the heart, being able to pick up specks of calcium that have dropped off while you excise a valve, or see that little broken cardia and being able to repair sitting inside the ventricle or like sitting inside the heart. And robotic surgery is actually that. You're actually sitting inside the heart because the camera goes into the heart. It's 3D vision, it's high resolution, it's 10x magnification. And imagine sitting inside the heart and doing surgery versus trying to look through a little hole, a peephole, what we call minimally invasive surgery, and then doing the same surgery. So I think, the gap is enormous. It's not small. It's huge when you talk about robotic surgery. I think that brings that added value. I think minimally invasive had all these components into it. It was a challenge. The end of the tunnel looked really, really interesting for patients. It also would question my skills as a surgeon. Anybody who took minimally invasive, it would question them in their skills. And it was something new that you wanted to get into, and it was a differentiator. So I would think there were multiple aspects into choosing minimally invasive. More than anything else, the first foremost thing was to set yourself apart from what was conventionally done, choosing the path that was not trodden. I think that was interesting.
Absolutely enjoyed hearing about your professional journey to being a world-class robotic cardiac surgeon. Share a personal story with us, something that our viewers would like to hear about the man behind the mask.
Madhu, you've lived in the US, you've worked at some of the foremost centers doing cardiac surgery, and you know how cardiac surgery has evolved. You probably have walked with so many of cardiac surgery's greats, and I have worked with a few too. And everywhere, wherever we go, cardiac surgery is the same. There's really no differentiator. And the only way we can measure a surgeon's skill, our thought process, our abilities, or whatever you want to call it, is by outcomes. And outcomes are only marginally different from surgeon to surgeon. But then you bring something else into the picture and you say, okay, I'll do the same operation, but I will do it with taking out a major, a morbidity. I would say a major morbidity in cardiac surgery is sternotomy, and I take it out and then I do the same surgery, and if I can give the same good results, I would stand out. And my patients would be much, much better off.
Building a new program, and especially when it is a yet unproven and novel technique such as robotic cardiac surgery, cannot be easy. It must have been challenging in the early days. I'm sure you had many people who questioned if robotic cardiac surgery was right or an appropriate choice. Since then, you've come a long way and you have established this procedure as a standard of care, and in fact a procedure of choice for people who want to, as you said, avoid cutting the breastbone, the sternotomy, or going through the side of the chest, the thoracotomy. So describe some of the early challenges. What were the challenges in establishing this program and scaling it up as you've done?
Well, many people may not know. In 2009, we started the minimally invasive program. We were actually laughed at. And in many of the forums when we went and talked about this, the majority of surgeons were simply, did not want to follow this path. In 2011 and 12, I did visit a few centers in the US. We were still seeking to expand on the minimally invasive part. We wanted to eliminate the hemisternotomy, so I went and visited a center in the US, in Miami. And I came back saying, let's eliminate the sternotomy for the aortic valve. Let's do an aortic valve through a mini thoracotomy, and we started the mini thoracotomy program in 2011. But at the back of my head, I always wanted to do a bypass without cutting open the sternum, what we call a mixed cabbage today. And it had to be multi-vessel because it was practically impossible to get patients for what was called a mid-cab, where you graft only one vessel and then send a patient for stenting for the rest of the vessels. And this was simply not possible in the Indian scenario, where most of the healthcare or most of the expenses for healthcare are paid off by the patient. It's what we call an out-of-pocket payment. So this was not possible in India because that would mean two different procedures being paid for. And most patients can barely afford one procedure. And then you can't say, I will do one half of the procedure, I will send you to my cardiologist colleague, and he's going to stent that, and it's going to cost you double. And there are going to be no takers. I knew this. So there was only one way out. We had to learn to perfect bypassing practically all vessels on the heart, minimally invasively, without doing a sternotomy. It was a challenge. So in the first 30 or 40 cases, we did the mini thoracotomy. We used the conventional octopus, conventional instruments, and tried to bypass. Often those surgeries were 8 hours at a stretch. And these are not surgeries that we came out of happy. It was frustrating. It was tiring, absolutely exhausting, I would say. And it was not like tomorrow morning I'll wake up and want to do the same surgery again. And I have a gift. And this gift is that I can forget. So I can go home today and forget what I have done today and come back tomorrow like nothing happened yesterday.
Practice in India is complex. At the same time, you're dealing with diseases that you commonly see in the West, coronary artery disease, diseases that are associated with lifestyle. But also you see some cases that are not often encountered in a Western practice, right, where you trained, such as rheumatic valve disease. Tell us a little bit about the complexity of performing cardiac surgery in India as compared to the Western cases, which are often described in large case series and in the literature.
Practicing in India is far more difficult than practicing in the West. In the West, you have a formula, and you sit there, you talk to the patient, you explain everything to them, and they're open to go through a procedure like this. So I think there are multiple facets, and I think the biggest factor is that if you bring in a new technology, it's going to be more expensive. And the question always is it worth spending that extra money on this? So I think practicing in a country like ours is way more difficult than working in the West, where most of healthcare is subsidized by the government or often completely covered by the government.
So as you were bringing in this new technology and as robotic surgery was becoming more popular, what did you have to do to gain the trust of patients as well as the doctors who were referring these cases to you?
So patients in this kind of, in probably Asian countries, trust the surgeon more than technology. And it's unique. But as you do more and more and the word spreads out, I now have patients coming to the OP and say, Doctor, I want robotic surgery.
So we are in a new world now. We hear, not a week goes by, right, without us hearing about AI, artificial intelligence, robotics. It seems like healthcare is evolving and changing at a very, very rapid pace. You're, of course, an early innovator in the space. You brought robotic cardiac surgery to India. Tell me, what are your thoughts about artificial intelligence and robotics in the future of healthcare?
And I was speaking to a colleague in the US who's a radiologist. And in the West, the radiologist has to is a rule in radiology that every scan that they do has to first go through AI. The software does the analysis, and then the radiologist seconds the analysis and then signs off. As of today, I think clinicians are still accountable, but I really don't know what's going to happen in the future. And this is going to happen to robotics as well. And I think there is going to be machine learning. And it may seem very far-fetched now, but I'm sure that if there are 5,000 mitral valve operations that are fed into a machine, and definitely some of those maneuvers that we do could be automatic, without a human having to intervene. And if things go wrong, then I'm not sure whether humans would be willing to sign off for the machine. They may be forced to do this, but I think it's still very fluid and evolving. But I'm 100% sure that many of the routine, repetitive tasks that humans do would be eliminated.
So what is your message to patients who may be considering cardiac surgery, potentially robotic cardiac surgery, and are a little bit concerned that maybe a robot is going to do their surgery and Dr. Sathyaki may not be in the room. How do you reassure these patients?
In the initial couple of years, I would have patients walk into the OPD, and there was this little lady who sat in front of me, and I told her, we'll do a robotic mitral valve on you, and she told me, "Doctor, is that robot going to operate on me?" No, please, doctor, I don't want the robot to work. I want your hands to do the surgery. This, it's very unusual, this kind of an approach. And then you have to tell them that, the robot is not going to operate, and that the robot is only an instrument, and I have to sit behind a console and control the robot, and I'm going to be there in the operating room all the time. So I think over time that has changed, and now I have patients coming into the outpatient and telling me, "Doctor, I want robotic surgery." And if you tell them that you are not a candidate for robotic surgery, they will tell you, "No, if you don't do robotic surgery, I'm going to go elsewhere looking for robotic surgery. I want robotic surgery only."
When we speak about robotic surgery, especially robotic cardiac surgery, one of the questions that comes up is the cost. Help us understand the differences between traditional cardiac surgery and robotic cardiac surgery, especially other considerations such as the duration of stay in the hospital, the need for ICU care, the extensive surgical incisions that are made with traditional cardiac surgery, and of course the cost associated with the procedure.
If I operated on a 50-year-old man and told him, "You take 3 months of rest," that's 3 months of work lost, 3 months of probably income lost. And I will give you a very nice example. This man makes bondas and sells it on a cart. He has 4 daughters. His only income is that cart that he takes into the central place and sells bondas. So this man came to me and said, requires a heart surgery, and he tells me, "Sir, I need heart surgery. I don't want open surgery. I'd already heard that we do this advanced surgeries." And I asked him, "Can you afford this?" He doesn't have insurance. And he's a Muslim, so he has 2 wives and 4 daughters, and he has to get those daughters married off, and he's a sole earning member in the family. And he comes and tells me, "Doctor, I don't want that open surgery. I don't have time to spend 3 months at home because I have to earn every day. And if you did open my chest, I can't push the cart." It's very sad, isn't it? And so then I asked him, "Can you afford this?" "I will take a loan, sir. It doesn't matter. I will take a loan. I have 4 daughters to marry, and I want to get back to doing my job within a week after heart operation." I said, "I'll do it for you." And we did whatever we could from the hospital side, cut off some of the cost, and went ahead and did this surgery. And of course, a week later, he was back to work. And even now he comes and is extremely grateful. It's almost 3 years since we did this now. We could actually get patients home faster. Patients would feel better. And I always felt that the psychological impact of open surgery was much more than its physical impact. And I think that's very hard to measure. And I don't think many of us as surgeons, as we train, can actually perceive the psychological impact. You often see patients come to your outpatient and break down after open surgery, or any kind of surgery maybe, but much more so with open surgery. It actually breaks you as a human being. They see themselves as weak after open surgery. I often tell patients when they ask me, "Sir, it's heart surgery, how many bottles of blood do you need?" I tell them we don't need blood. And for some patients, it's actually unbelievable that you can do heart surgery without blood, because the old concept was bring in, 6 bottles of blood, 10 bottles of blood. Last week, I had a team from Vietnam and Thailand, a team of surgeons who came here to watch what we do. And this is following a visit to that country a couple of years ago, a year and a half ago. And I showed them a robotic mitral valve. And they were all standing and watching while I did the repair. And I was talking to them, "What do you think I should do? Shall we do this? Shall we cut this little piece off? Shall we put a myocardium?" The beauty is also this part, because the entire team gets to participate when we do robotic surgery. There's everybody's input, there's everybody's feedback, everybody knows what you do, everybody knows the outcome of what you do. That brings in a lot of confidence. And it's great teamwork. And the next day, these doctors, I took them to the ICU, and they were actually thrilled to see the patient walking. and by afternoon this patient was home. And this is another story for you. I'll tell you what, we discharged this patient, and he's a young man, he's about in his 40s, and we had done a mitral valve repair, and it is an absolutely good repair with no leak at all. And the patient's wife was standing outside and screaming. And so I sent somebody out to see what is it that she's screaming about. And she was thoroughly unhappy that we're discharging this patient after a major heart surgery the next day. And then she went on to meet the Director of Medical Services, the DMS, and then complained that, you know what, they did a major heart operation and they're discharging today. It's only yesterday he had the heart operation. And then the DMS and his team and nurses came into the ICU, and my anesthesiologist was there, told him, sir, why don't you take a look at the patient and tell me why this patient needs to stay in the hospital. So he went through everything and files, and there's really no reason, and he asked the patient, do you want to go home today? And the patient said, absolutely, there's no need for me to stay in the hospital, I'm good.
Sathyaki, as a very successful doctor and surgeon, as an innovator in this field, what is your advice to future doctors, those who are considering this career, perhaps a career in robotic surgery?
I believe that a lot of what we do will go away to catheter-based technology in the future, but surgery will still have a major role where catheter cannot, do what surgery does. And a lot more of surgery is going to go the robotic way, and less and less is going to be done open. And for young surgeons, I think you've got to really think outside the box to remain relevant. And I think what you imagine can actually come true. So I think it's very important as young doctors, we need to really imagine what is possible, because everything that you imagine is possible. So I would encourage everybody to walk this way. It's really worth it, and it's wonderful.
Sathyaki, it's been remarkable talking to you about your journey and the incredible contributions you've made to the field of medicine and robotic cardiac surgery. Thank you for everything that you do for our patients and on behalf of Apollo Hospitals.